tonight, I'm really excited about this session. We have Amber Chewning of Novant Health Wissinger Cancer Institute, and she has over 12 years of experience, 10 years in oncology, focusing on lymphedema and the therapies that we can use to help treat lymphedema. Thanks for being with us tonight, Amber.
Thank you so much. I'm going to go ahead and share my screen. I have a short presentation. I try to keep it really simple. When I've done these presentations before, I really think the bread and butter just comes from conversation. This is actually a small group, so I'm hoping you guys will have time to kind of ask those personal questions if you feel comfortable sharing. I feel like sometimes that's what people really remember taking away from it. And just as you know, I'm always happy to share these slides afterwards, so I'm happy to email them and then you can share with the group if you ever want these for reference. I'm happy to do that. I'm going to go ahead and share my screen if I can do this again. You think I'd be good at all this stuff by now after doing it for 2 years, but okay. Good. Can everyone see that okay? Thumbs up? Great. All right. Well, my presentation this evening is about lymphedema management. Most survivors have heard of lymphedema, whether they've experienced themselves or maybe someone they know, or maybe their nurses or their physicians have talked with them about it. And it's always interesting because a lot of my patients are surprised when I mention that physical therapy is kind of the gold standard of management and treatment. It is your first line of defense. A lot of people have had physical therapy before, but maybe it was for shoulder pain or back pain, or maybe really focused on range of motion after their breast cancer surgery or knee replacement, all kinds of things. So when they end up in physical therapy again for lymphedema, which seems so different, I get a lot of surprised looks. But I'm really happy to be here. I love talking about this kind of stuff. I really believe knowledge is power. I think knowledge has a time and a place. So no matter where you are in your journey, whether you have just been diagnosed, whether you've just had surgery, whether you have lymphedema or you've had it for 10 years, I think there's always something to take away from this kind of thing. So I'm really happy everyone's able to join. So just to start, a definition of lymphedema. It is a buildup of lymph fluid in the body tissue just under your skin. So it's really close to the surface. It's different than regular edema. So if you've ever sprained your ankle or got swollen after an airplane flight, that was edema. That swelling's a little bit deeper. Lymphedema is really close to the surface. So it is something that can be really, really bothersome. I always say a lot of my patients kind of feel it before I can see it because it is so close. It kind of creates this pressure on the skin. With breast cancer, it's usually a result of lymph nodes being removed or radiated. In this country, breast cancer is actually the most common cause of lymphedema. And it usually occurs most often in the arm or hand. However, I'm starting to see it more and more really in the trunk, in the chest, or the breast. Specifically, you're at risk for lymphedema in the quadrant of your body where lymph nodes were removed or radiated. So for example, if I had surgery done on my left side, I'm at risk in my hand, my arm, my trunk, my chest, only on my left side. If I've never had anything done on my right side, I'm not going to get lymphedema over there. And if I've never had any issues in my lymph nodes in my groin, I'm not going to get lymph nodes or lymphedema there. I always describe it to kind of make it more simple for my patients, like toll booths on a highway. We have this lymphatic fluid all over our body, and it runs through these vessels, and that fluid's just cruising. If we're driving on a highway, there's 10 toll booths, we're cruising, no problem. But then one day we wake up and wow, there's only 5 toll booths. We're going to get a bottleneck of traffic. And that's kind of what the lymphatic fluid does after those lymph nodes have been removed. It gets backed up into some kind of body area, whether it's your arm, hand, or chest. I think I have risk factors on the next slide. There we go. Okay. So like I mentioned, cancer surgery is the biggest risk factor, specifically axillary lymph node dissections. That being said, I see all kinds of things. I've seen patients with 1 or 2 sentinel nodes being removed. They can get a little puffiness. I've seen patients have, 20, 30 removed and never have an issue. So just take it with a grain of salt. But historically, cancer surgery is the biggest risk factor. You can see the other risk factors. I think the second most common one is radiation. Even though it's not removing the nose, it kind of traumatizes the ones that are still there. So that can cause some issues as well. But I will say that, gosh, and I mean, the relatively short amount of time I've been doing this, improvements to surgery and radiation have really decreased the risk of getting lymphedema. And the world of breast cancer rehab in general has really changed in 10 years, where if someone had lymph nodes removed, we may have initially told them, don't use that arm, don't lift. And now we're really changing things because we're kind of realizing, gosh, our survivors are mothers, they're grandmothers, they're lifting their grandkids, they're working out, they're nurses, right? So it's not like we can't use that arm anymore. So they're really prioritizing and changing things to kind of push early mobility and range of motion more than they used to, which has been really cool from a physical therapy standpoint. So if any of you on the presentation have experienced lymphedema, oops, I'm going to try to go back. You guys can probably speak to this a little more than I can, but the things that I most commonly see when my patients come to me with swelling is swelling or puffiness. It's something they can usually see. There's a few different ways we can measure that. The most common one you'll see in physical therapy is we'll actually take just a regular old tape measure and kind of take the circumference around your arm in a few different places. We'll usually measure both sides so that we can kind of compare normal to the side that's affected. And I don't panic. I don't think it's a big deal if one area is a little bit different because we all get swelling. If I stay up late and eat salty popcorn and I wake up the next day and I kind of feel puffy, nothing that we're going to worry about. But if it's consistently larger on your affected side, that's when we're going to start our detective work and kind of say, okay, is this lymphedema? But like I mentioned, people will often experience or feel lymphedema before I can measure it. So feeling that fullness, feeling that heaviness. Other things that you might experience are the jewelry or sleeves that you have on that side might feel a little bit tighter or different feeling. You may have decreased visibility of certain landmarks. So I kind of say, if I stretch out my fingers, my tendons pop up, I can see all my veins. I might not feel swollen, but I might not see those tendons on one side versus another. And lymphedema can hurt. It can be quite painful. It can cause problems lifting the arm. It can feel sore, almost like a bruise. I mentioned that it's really close to the surface, so it can kind of create a pressure, almost like a discomfort or callus-like sensation, kind of close to the skin. And you can also have skin changes. So sometimes there can be redness. It can feel a little like leathery or hard or dense. That's usually something that happens with more chronic lymphedema. So if it's been there for a few months to even a few years, your skin can start to change. And I always highlight this last bullet here, that it's not to be confused with blood clots or infections. Lymphedema in general is something that happens very gradually. So it's something you might feel and it's kind of tight and yucky, and then you might sleep and it goes away, but then the next day it's kind of there again, and that's very gradual.
So Amber, the slide that you have up, I'm seeing the what is lymphedema. Are you able to go to the next slide with the risk factors?
Yeah, so that is what is showing up on my screen, but let me just close out and go back in. Yeah, so I just wanted to remind everybody that blood clots and infections can happen, and they're a little more sudden. So if you ever wake up one morning and your arm just feels really big and heavy and it's red and it hurts, and it was not like that at all the day before, that's actually considered a medical emergency. So we don't want to confuse that with lymphedema and say, oh, I have an appointment with Amber in 3 weeks, I'm not too worried. Something like that should kind of trigger a visit to the doctor or call to your nurse just to double check. But yeah, as physical therapists, we always screen for that as well. So I wanted to specifically talk a little bit more about what a physical therapist does if you have lymphedema. Again, this is always the first visit with me is a lot of education. We talk a lot about anatomy and what lymphedema is, kind of how we got here, the risk factors, and what may have happened to your body to cause this. On the next slide, it's going to have a little more detail about what we actually do. The first visit, like I mentioned, is usually an evaluation, so getting to know each other. We're going to look at your arm. We're going to look at your trunk. We're going to look at what's going on. We're going to take measurements, and this always helps. That first visit, we always want to get what's called a baseline, so kind of where you're at that first day. So we're typically going to measure the volume or the circumference of the arm so that we have those numbers. And I will say, I see plenty of patients that don't have lymphedema, but they want to come just to kind of talk through this with someone in a little more detail. And there's so much power in having those baseline measurements taken by someone professionally. So if something does happen 3 months later, we always have those numbers to come back to. So I really enjoy just kind of seeing patients, even if it's just from an education standpoint, because I would always rather have someone in my office that does not have lymphedema who's being proactive than someone who does. We'll also check out range of motion. A lot of our patients are, in the phase of treatment where they've already had surgery. So they might have pain associated with that. They might have problems with range of motion, but the lymphedema itself can also create poor range of motion, whether it's causing heaviness or pain in the arm or elbow. We'll talk through your life. We want to know you. We want to know kind of what you've been through. Is this your first time dealing with lymphedema, or is this maybe your second or third? Have you had, one bout of radiation? Have you had 2 or 3? But we also want to know what gets you going in the morning. We want to know what's functional and meaningful to you. Because numbers are numbers, but we not only want the arm to be smaller, but we also want you to be able to lift your grandkids or cook a big meal for your family at Thanksgiving. So we want to know like those details to kind of know what we're working towards. And that just helps us make your experience a lot more, again, meaningful and personal. We talk a lot about skincare. So it's important that we monitor for infections, cuts, and scrapes. If our patient is actively going through radiation, we're kind of the ones that are keeping our eyeballs on you. Obviously, you're seeing a radiation nurse each day, but as physical therapists, we have a little more time with our patients in general. So we're kind of keeping our eyeballs on your skin, making sure it's staying well healed and well moisturized. All of that can really help decrease your lymphedema risk. We can also make recommendations for appropriate skincare products if needed. Again, this is kind of my favorite slide and usually the one that creates the most discussion, but this is kind of what we do. Once we evaluate you and say, okay, this seems like lymphedema, let's move forward with management. These are the big things that we tackle. The biggest thing that we do is something called complete decongestive therapy, CDT, which is a mouthful. That includes all of these bullets I have here. Hopefully you can see them. The first one is called manual lymph drainage, and this is where it gets a little bit wordy, so hang in there with me. But that is a special massage technique where we reroute that fluid. And that's what's really cool about the body is we have 800 lymph nodes. So if some of them aren't quite working, there's a technique called manual lymph draining where we can move that fluid to other areas of your body where you have healthy lymph nodes. And it kind of feels good. It's also analgesic. It kind of helps reduce pain. It's relaxing. It's very gentle. But it is something that we do for the patient, but then we also teach them how to do it because it is something that works best when done each day at home. So we do that in physical therapy. You guys may have seen or heard of compression garments. Usually we're giving a lot of guidance from that standpoint. If someone has quite a bit of lymphedema, they might go through what's called compression bandaging. And that's kind of an intensive compression technique where we wrap the arm to really get that fluid out. If someone is a little more mild, or maybe they've bandaged and then they're kind of done with that because the arm got smaller, we might move them into a sleeve, which kind of looks or feels like Spanx. And the idea is that that just kind of keeps the arm from filling back up again. So that can be really helpful. We do a lot of hands-on work called manual therapy. So you may have heard of cording before, myofascial release. Those are techniques where we get our hands on you and just kind of move the arm, move the joint, stretch the skin to kind of help that fluid move a little bit more. And again, it can really help reduce pain. And then the fourth dash here is kind of the most common one because we are physical therapists. This usually makes sense. We talk a lot about exercise. Aerobic exercise is strongly encouraged. Like I mentioned, that was one of those things, gosh, years ago, they might say, you're sick, you have cancer, we need to rest. And sometimes that is very much the answer. But in general, we want our people moving. When our heart rate goes up slightly through exercise, our lymphatics turn on. So it kind of jumpstarts your system. So we encourage aerobic exercise. If someone's not used to exercising, we're your guides. We're kind of the ones that kind of give you those appropriate recommendations of what you can be doing on your own. Strength training. We also talk about strength after breast cancer and how important that is to have strong muscle pumps to kind of move that fluid. We want those muscles to tug on the bones so that they stay strong and healthy as well. There's a group of exercises for specifically lymphedema. That's really gentle and easy. It's breathing exercises to kind of push that fluid out of your system. Stretching, range of motion, swimming, all of these things we can provide guidance on and are typically encouraged as long as your medical team is giving you clearance. And then these are some pictures. I just threw these in here in case anyone had questions about what that is and what that looks like. And I always say there's a very big spectrum of compression options and a big spectrum of lymphedema in general. It can range from very minimal and mild to someone who has had it for years, or maybe it's been untreated and it's a little more severe. Again, that's our job, is to kind of assess the situation, make a recommendation on what's best. So I can have two patients with the exact same surgery, the exact same number of lymph nodes removed, the exact same radiation schedule, and they can have totally different presentations. One might be bandaging, the other one might need no compression at all. They just might feel a little puffy here and there. So again, that's our job, to kind of help guide you through all of that. I'm personally a PT. I float around a little bit. I'm at Novant Health. I know I'm certain most of you come from all different areas, whether it's Atrium, Novant, different regions of Charlotte. I always throw this in there because it's always a question I get, is like, okay, this sounds great, but how do I get to you? So I throw in this information in case anyone is interested about more details. Atrium also has a lovely physical therapy center with several PTs that are trained in lymphedema management. But the ones I can speak to, this needed to be updated. I think I wrote 4, but I have about 6 or 7 clinics now. We've grown tremendously. When I first started doing lymphedema, we called it Lyphedema Clinic because there was just one area, I think 2 or 3 of us that were doing it. And now we've just grown. There's almost 14 of us treating lymphedema. So there's a lot of us. We're kind of widespread throughout Charlotte. Physical therapy in general in North Carolina is a direct access state. So what that means is you don't necessarily need a referral to see a physical therapist unless you have Medicare. Medicare needs a referral from your doctor. Other than that, if you have private insurance, you don't necessarily need a referral. Out of courtesy, we typically encourage you to get one, just to make sure it's safe and appropriate. Your doctor's aware, because lymphedema management isn't for everyone. There's certain contraindications, there's certain precautions we always want to take into consideration. In general, I think it's really good and healthy, but every once in a while we have a patient where it's not appropriate. So out of courtesy, we just always want to let your doctors know what we're doing. We're able to usually see your chart and kind of make those recommendations and make those screens to make sure it's appropriate. But again, we just want to let your team know that that's what we're doing here.
Well, and Amber, if I can ask while we're in this section, have a question. What would be the typical time frame after a person goes through breast cancer treatment and surgery that they would come and see a physical therapist? Is there a waiting time frame, or is it something that they can?
Yeah, there's no perfect answer. So in an ideal world, I can speak to what would happen ideally. I love to see patients before they've even had surgery. just to
Okay.
kind of talk to them about, hey, sometimes this can happen. And it just kind of, it gives them someone to know, like they can email me if they have concerns, right? Um, Unfortunately, that doesn't happen often because it's such a fast process, right? The diagnosis is made, we're in surgery, within weeks sometimes. So it doesn't always happen like that. And unfortunately, sometimes we just don't have the manpower to make it that quickly happen in our rehab department. But I love to see patients as timely as possible. But I will say after surgery, you're also just going to have post-operative swelling. So a lot of my patients that see me kind of immediately after surgery who have swelling or fullness, you can't technically diagnose lymphedema for up to 4 to 6 months because you can have just normal post-operative swelling. So can you manage that through some of these techniques? Absolutely. But I never want my patients to go into panic mode of, oh my gosh, this is lymphedema, because it's typically diagnosed a little bit later on.
Okay.
Yeah, but some surgeons, they don't want us to touch anybody for about 6 weeks. So, there's an education going on in our rehab department where we're trying to tell our surgeons, hey, we don't have to mess with your surgery here. We just want to talk to these people, take these measurements, talk to them about what they're experiencing and what's normal versus not. So yeah, I always love a timely referral. So we're slowly getting there.
Well, and would it be something that you would also help with recovery of surgery and giving that patient some good exercises that they can help their mobility and that sort of thing? That would also be.
Yeah. So, I kind of catered this conversation and this PowerPoint to really include lymphedema, but we see breast cancer survivors from all different walks of life. So I would say the majority of what I see is just post-operative rehab for range of motion and pain reduction. Like I said, we don't even really mess with lymphedema sometimes for a few months. We might talk about prevention and kind of what it looks like. So they're on the lookout. But most of what I see is really for range of motion, exercise, strengthening, just getting back to feeling like you.
Right. Wonderful.
Yeah.
Well, thank you so much. This was really informative. It was a pleasure to have Amber Chewning from Novant Health with us tonight.